This month alone, we've seen horrifying of cases of violence against nurses. One nearly beaten to death and another group held hostage. These aren't isolated incidents. They're a stark reflection of the escalating dangers faced by healthcare professionals. If you're concerned about nurse safety, or if you just want to understand how to make a difference, please stay till the very end. I'll be sharing crucial strategies from the perspectives of a frontline nurse, a nurse manager, and even how the general public can help. Hi, I'm Nurse Tracy of Resiliency Within. And if you haven't subscribed, please consider doing so. Hit the notification bell so you can know when I post a new video of living life beyond nurse burnout. I've survived 20 years of nursing, 17 of those at the bedside, with 8 of those years as an emergency department nurse. My last 3 years was at an advice call center. I've experienced nurse violence many times, sometimes on a daily basis, sometimes several times a day on a shift. And I know that's not uncommon to others. I've put together the top ways that have helped me with violence at the hospital, and I want to share these with you so you can feel empowered at the bedside and beyond. First, we'll review these horrific cases, then we'll get some facts established. We'll get some stats about workplace violence for nurses, and then we'll bring it all together with actionable steps that any one of us can do, even members of the general public. So let's review these horrific cases. On February 18th, 2025, Nurse Leela was viciously attacked. The patient had come to Palm West Hospital in Florida. The family had asked for the patient to be Baker Act, which is an act of involuntary holding on to someone to assess them and give them treatment. And here in California, we refer that as a 5150. The hospital originally did not want to do that, but then the patient had run away in the middle of getting a CT. So then they did put him on a Baker Act. But Nurse Leela, who was this patient's nurse, according to her daughter, Dr. Cindy Joseph, she was never trained on how to de-escalate situations or how to have a patient who's been Baker Acted. And I still have some questions about whether or not this facility is even allowed to keep a patient who's been placed on a Baker Act. The other very troubling thing to me is there was no security guard assigned to this patient's room. And that's a 100% no-no. This part's really graphic, so you may want to just return back in about 20 seconds or so. The patient somehow got a hold of some scissors and used them upon her eyes. So Nurse Leela will likely not have use of her eyes anymore. Will not be able to see again from either eye. He also managed to break every bone in her face. So many 911 calls came in. People that were standing and holding their doors so that this person didn't get in. And the thing that's really troubling is the 911 calls that came out with the hospital administrator or maybe the CEO talking to the 911 dispatcher, where he says, quote, "We had a Baker Act beat a staff member unconscious, now running around the building," end quote. The 911 dispatcher says, "You said they assaulted the employee till they passed out?" Hospital administrator, quote, "Yeah, unconscious. I'm not worried about that part. I need the Baker Act dealt with." And that part's really troubling to me because here somebody is pretty much left for dead, actively dying. And it seems that, does the hospital care about our lives? Do they worry about the situations that we're put in, especially in a culture where hospitality is emphasized over staff safety? The thing that is really heartbreaking to me is that Nurse Leela is trached, she's ventilated, she's on NG tube feedings, and according to her daughter, she's starting to make some progress. I mean, this is a nurse who's worked for 21 years at this hospital, and she's 67 years old with grandchildren, and now will not be able to see out of her eyes, let alone what's going on with the healing of her face, with what kind of disfigurement is going to happen and the brain bleeds that she got from the assault. Okay, let's talk about the next horrific case about the UPMC hostage and shooting situation that happened on February 22nd, 2025, where this gunman came in, who was a visitor before to that ICU setting, walked right in with a loaded weapon into the ICU at 10:30 in the morning in a bunch of zip ties. Nurse Tosha talks about her horrific experience. It was hard for me to read that and not picture like that could be me, or that could be somebody that I know. That these are very real situations, none of which we were ever trained for or went to school or went to college to realize, hey, I'm going to go into a profession where I'm going to be severely beat to death. No, none of us ever thought that. So to hear her explanation of being taken hostage, about how her colleague, one of the other nurses, put tie wraps on her behind her back, and then being dragged to the doorway, was very scary. Very scary because of how real it is, how it could happen to any one of us at any time. 6 people were injured, and Officer Andrew Duarte died protecting other officers. A doctor was shot, a janitor was shot, a staff member fell. It just sounded like there was a barrage of bullets going around. It's so hard to wrap my mind around this. What's the motive? That there was a physician assistant on Facebook by the name of Mendoza who remembered interacting with the gunman earlier that week. Several interactions, nothing which was sounding too traumatic negatively, that the gunman had a very sick family member and the prognosis wasn't looking good until eventually this family member succumbed to whatever illness they had. And they all sat down and talked about feelings, about what it's like to lose someone. And even the physician assistant, Mendoza, recalled sharing stories about him losing people. And the gunman at that time was appreciative, and they thanked one another for sharing their stories. So it was really shocking for him to understand that this was the same person that he had so delicately dealt with earlier that week. And the barrage of bullets took place. The gunman was fatally shot by the officers. So definitely a terrible situation. And to think, meanwhile, all of this is going on, all of the fear and chaos, there are patients there that probably needs their meds titrated, probably needed blood draws, probably needed medication based on blood draws. All of these things couldn't go on, couldn't take place because of this now hostage situation. So this is why members of the general public, we need your help too. Okay, let's talk about some facts about workplace violence. So, did you know that the OSHA Act of 1970, called the General Duty Clause, requires for all employers to provide a work environment free from recognized hazards that are causing or likely to cause death or other serious physical harm. And so if this clause is in place, why is it that there's a lot more awareness on patient safety than there is on healthcare worker safety? It had to take these 2 back-to-back incidents for everyone to understand and see the atrocities that unarmed people have to deal with. OSHA has also said that workplace violence is the 2nd leading cause of fatal occupational injuries in the United States. A nationwide survey done by National Nurses United in 2023 showed that 81% of nurses report at least one violent episode within the past year. And the 3 most common type of violent being verbally threatened, 67%, physically threatened, 38%, and being pinched or scratched, 37%. And has that happened to me? Yes. I've been punched, I've been slapped, I've been kicked, I've been kneed, I've been elbowed, I've been spit at in my face, I've been verbally assaulted, way more than physically assaulted. And to me, it just becomes something common to accept. But never once when I was in nursing school did my textbook ever show pictures of violence happening, or was I ever taught about violence. All I saw was a smiling nurse holding the hand of someone in a hospital bed who's smiling back up at the nurse. And this is why 6 out of 10 RNs in that same survey either changed or left their job or consider leaving their job. And this is just going to contribute to the nursing shortage, because as a nurse, I want to make sure that the hospital has my safety, they have my back, that they worry about me, that I'm just not a number and they could just hire another nurse off the street to get assaulted. For some of us, the attacks may be so bad that we even fear coming back to work, or fear of somebody walking behind us. Maybe we feel embarrassed, like, oh, I probably could have did that better, or I said something wrong to make the patient escalate, or I didn't give their medication right, or maybe I touched their hand wrong and that's why they got mad. And a lot of us don't think of reporting any of these incidents to anyone or making an incident report. Why? Because it takes time, and because we're not told to do that that's the right thing to do. And we're often kind of led to believe like this is the part of the job. If you're an ER nurse, if you're an ICU nurse, that's what you deserve. This is what happens. I mean, I was watching a story where there was a police officer who quit the force to become a nurse, and he said being a nurse is way more dangerous than when he was a police officer. So what can we do? Number one, I want you to go check your hospital policy and procedures. I guarantee you that they're going to have a policy and procedure about workplace violence, about what happens when a patient gets aggravated or aggressive, and what we're supposed to do in place of that. And if you don't know where to find this, ask your nurse manager, ask HR. Does your hospital have lockdown procedures? In one facility, yes, we had lockdown procedures. Anyone who came in because of an injury from a violent act, like a stabbing or a shooting, the whole place went on lockdown, and there were security guards placed at every entrance. And visitation was severely diminished, if at all even allowed. And in other places I worked at, there was no lockdown procedure because they never expected these kind of people to come in. But again, it's by word of mouth. Again, what does the hospital policy and guidelines say? Because according to what OSHA wrote, that the employer has to have some sort of procedures in place, that our employers has to make sure that we're in a workplace free of harm. Do you have any panic buttons in your unit or department? Do you know where they are? Do you know what a red phone is? A red phone is usually a phone that has the old-fashioned jack into the wall. So it's not a phone that is those digital phones that work over an IP connection. Rather, it's an old-fashioned phone that in case there's a disaster or a loss of power, this phone connects directly to dispatch. And if you don't have that, do you know how to get one? Surely you can start asking your manager, asking HR how to get this in. And how does your organization deal with those who have known aggression outbursts towards healthcare workers? In one place that I worked at, there was a banner on top of their chart in Epic that would let us know, and there was a whole protocol for that person. When you clicked on that, you could see what the protocol, through a deciding committee, it wasn't one person that decided it, how this person was going to be cared for. Okay, from now on, we'll see patient A only in the ambulance bay outside. There will always be 2 security guards and an ER tech or a patient care assistant, 1 registration clerk, but never at one time will patient A ever be alone with 1 staff member. So does your organization have anything like that? And for any of you nurse managers that may be listening, do you know of any of these procedures, and can you share them with your staff, especially during a time when all this is out here on the news, making us feel very vulnerable, feeling very worried, very concerned, with more anxiety? How can you make your staff feel safe by letting them know what policy and procedures are in place, especially with those items that I mentioned? Point number 2, trust your gut. If something's starting to escalate, or you're having this feeling like, I think this might not go well, or I need to go in here and talk to this patient, don't go by yourself. Bring someone else with you. Call your nurse manager, ask them to come in there with you. Empty your pockets, remove your stethoscope, remove your pens and pencils, remove your keys from your pocket. make sure that you're the one that's standing closest to the exit. And also, this could happen with family members too. In that hostage situation, we see that the gunman was a family member and not the patient, even though oftentimes the patient to caregiver violence is the most common experience by us. Number 3, ask for training. In one place that I worked at, security gave us training of something called PROACT, and I'll put the link in the description box below. PROACT is a type of self-defense training that really should be given to all hospital staff. Because as we've seen in these 2 actual scenarios, one was in the ICU, another one was on the med-surg tele unit. But as I said, the training I got is because I was a part of the ED staff. This method was put together by Paul Smith, who was a doctoral student in Southern California in a psychiatric hospital, and he became overly concerned with the amount of aggressive escalations that he saw during his time there. And that's how he developed this training. So again, it's in the box in the description below. Please ask for it. Please send an email to your manager asking for it, so that way you can have a dedicated communication chain that you're asking for a training. And again, if you're a nurse manager or somewhere in leadership, how can you get this training for your staff and yourself? Another thing that we can do right away as nurses is take a free course. There is a free course by the C for nurses and workplace violence. It's a very good course. I'll put the link in the description box below. It's very simple, easy to follow, and I really enjoyed the course. It had up-to-date stats. It had the types of violence, which included horizontal violence like bullying, and it included actual videos of nurses telling their stories, which was so heartbreaking to hear, and I totally related with each and every one of them because I had a scenario much similar to the ones that they were explaining. And the lasting effects that violence has on any of us involved and our family members. And finally, prevention strategies for nurses and prevention strategies for hospitals. So go to the link below for the CDC course. It's very good. I highly recommend, because at least it's something that you can start learning now. And there's a bunch of cool checklists in there. Okay, let's take a break. If any of this is resonating with you, please hit that like button. And what's been your experience with workplace violence? Please comment below so we can all learn from each other, and to know that this isn't just something that's only happening to me or happening to these particular nurses in these stories, that this is happening all around us. Point number 4 is the situational awareness, and that's for all of us, including nurses, but including all workers and everywhere we're going, whether we're going to Target or Costco. Are you aware of your exits? Do you have an exit strategy in mind? Are you paying attention to the people that are nearby you? And I'm not saying this is something that you have to know at all times. It's just something to keep in the back of your mind. If you work at a desk, do you have a mirror by your monitor so you can see who's coming up behind you? Does your bathrooms at work have locks on them, so that way in case there's a violent situation, you can get to a safe place? Does your workplace have a safe place that has a lock on it where you can go and be safe? For myself, I enrolled into Krav Maga after I saw one of my co-workers physically assaulted really bad in the face. I just thought, whoa, I'm gonna have to learn how to protect myself. And that particular person, there was a security guard at the front of the doors, but the patient was just so much faster than the security guard. And so that led me to the decision to take a self-defense class called Krav Maga. But you can take any self-defense class that is in your area. And what I liked about it is that it not only worked my muscles and my core, because we did just some fundamental exercises every time, but it also gave us some real world skills. How to disarm somebody coming at me with a knife. How do I disarm somebody who has a weapon? Those were things that we could practice over and over in the class, and it was really fun. And lastly, tip number 5, and this is for all of us. This is for nurses, this is for doctors, this is for any healthcare worker, any family members of healthcare workers, all the members of the public. Let's ask for more protection for healthcare workers. How do we do that? First, we want to find our U.S. representatives and our state senators. How do you do that? You go to www.usa.gov/elected-officials. I'll put the link in the description box below, and that's where you're going to enter in your address, and it's going to give you a list. You're going to want to click the one that says Federal Office, and it'll expand that menu, and on that menu it'll have your U.S. representatives that represents you. You can click on your U.S. representative. It'll take you to their website where there's a contact page so that you can send them an email or call them and let them know that as a constituent, healthcare worker violence is something that's really important to you. What bills are out there that you can support and ask them to support in your behalf? What bills have been approved for them? Okay, same page. You'll click on the part that says state officials, and then you'll see all the representatives in your state, but you want to look for the one that says state senator. You click that one, that's the senator of your district who represents you as a constituent. You as a constituent has the voice that's so powerful when it comes to our state senators. So you call up your local district senator and ask them, hey, what can we do to protect healthcare workers' safety? What bills are out there? And then ask them to vote yes on those bills. There are some bills out there that already do protect us, like California Senate Bill 553. 553 requires that employers develop and implement a workplace violence prevention plan. But for some reason, healthcare facilities aren't included in that. But don't worry, because there is another bill that came through, S1176. And that bill passed in 2023, and this is a federal bill which does target healthcare and social service settings to create a workplace violence prevention plan. And this bill directs OSHA to establish a new workplace violence prevention standard. So far, one has not been established yet. Hopefully in the year 2025, there will be one. But don't worry, there are actual guidelines OSHA put out. I'll put them in the link in the description box below. There's another bill, Assembly Bill 977, which increases penalties for the assaults on healthcare workers, going from a misdemeanor to a felony. But I did want to review some of those OSHA guidelines that they have out there for the workplace. And some of them were the ones that we talked about already, like panic buttons. When possible, rooms should have 2 exits. Provide a safe room for all employees. Arrange furniture so that there can be a clear exit. Have curved mirrors, so that way we're able to see people coming around corners. Have closed circuit video inside and outside of the facility. Have a reception area with bulletproof glass and maybe even a locked door. Have bathrooms that have locks or keyless entry by badge entry only. Lock all unused doors. Have an established area for patients and their family members to de-escalate. Divide the waiting room areas so that way agitation does not spread. Secure furniture or anything else that could be used as weapons down. Ensure cabinets with syringes and needles all have working locks on them. Have a sign that states that violence is not permitted and will not be tolerated. Have a log in and log out procedure when it comes to patients and their visitors. And also having a safe word established with the patient so that when a visitor comes and they're starting to feel unsafe, you know that safe word. Update the staff and or management team about any violent episodes. Treat and interview agitated and aggressive clients in a relatively open area, especially if you are alone. Ensure workers are not alone, especially when performing intimate evaluations. Provide staff a way to have an escort, especially late at night, to the parking lot. Establish a buddy system, especially when personal safety is threatened. Require that all workers report assaults to their supervisors or managers immediately. Establish a liaison with the local police who can assist counselors and state prosecutors. Provide timely information to people who are waiting. Institute sign-in procedures and visitor passes. Enforce visiting hours. And have a visitor restriction on patients with aggression in the past. Use properly trained security and counselors to respond to aggressive behavior and to assist with de-escalations. Ensure that adequate and qualified staff members are always available to de-arm and de-escalate a patient situation. And avoid wearing anything that hangs down from the neck, like a lanyard, a stethoscope. Remove anything sharp from the pockets, like scissors or keys or pens. Keep the desk and the nursing stations and the physician stations and the work clerk stations free of anything that could be used as weapons. Have a little locking drawer. That's where you're going to keep your pens and pencils and scissors. No photos that have a glass frame with it. So I'll include those tips from OSHA onto workplace prevention cheat sheet. I'll also include in the description box below my de-escalation cheat sheet, where these are real life scenarios with actual responses that I've used to help de-escalate situations. At least it could buy me enough time so I can get additional help or get my pockets emptied and try to calm things down a bit. Be sure to check out the next video, Simple Yoga for Nurses, to relieve stress, your back, and your feet, so you can find physical relief from your body that we have built up all shift long. And see you on the next one.